Module I, Integumentary System, Nursing 106. Today we're going to talk about diaper dermatitis, seborrheic dermatitis, allergies, eczema, atopic dermatitis, bites and stings. Okay, looking at diaper dermatitis first. It's most common in the child between 9 and 12 months of age. Don't see it in the very young child very often. They are primarily on milk, breast milk formula, and it's not until really we add the solids to their diet that we start seeing this. The child is more active, and so maybe doesn't get his diaper changed as often. Urine's more irritating, more concentrated. Causes prolonged contact with irritants, but it also can be caused by the soaps and detergents, ointments, and even friction where they're sitting in a wet diaper and it's being rubbed around on them as they move. Candida albicans infections is a form of diaper dermatitis, which we'll talk about as well, but it's treated differently. So what we see is a typical any skin that's been exposed to moisture for a period of time. You get the friction and the abrasive damage, and then you start seeing the symptoms of dermatitis. If you have candida, notice the difference between this picture and the previous picture. This picture, the rash is much redder. Raised borders is noted on this one. This is a candida, which is a yeast infection. It's very painful, and it can only be treated with antifungals. Regular diaper rash treatment will not work on this one. So we use nystatin ointment. If they have candida elsewhere in the body, which they may have thrush, and they may have a rash anywhere, then they may give them parenteral nystatin or oral nystatin. Treatment for regular diaper dermatitis. Well, keep the child dry. One of the things that has helped, and we're seeing less of it for this reason, is our disposable diapers. They do keep the baby dry. You have that stay dry lining that really does keep moisture away from the babies. So we're seeing less incidents. If you have a child who has a diaper rash, though, it's beneficial to leave the diaper off as long as possible. Expose it to air and sun. No plastic pants because that holds the moisture and the heat in. You can use petroleum or zinc oxide. These are barrier creams. Petroleum actually protects the skin from moisture. Zinc oxide has that same mechanism, plus it has a medication to help the skin heal. One of my favorites is A&D ointment. A&D ointment is also a petroleum based, and it contains vitamins A and D. We don't use talcum powder on babies. Talcum powder actually contains a chemical that's very hard on the lungs, and so if they inhale it, and you think about when you put talcum powder or powder of any kind on somebody, it tends to form a cloud where it's sitting. Cornstarch is safe. The baby powder is fine. If you are using any powder, not using talcum powder, but any powder, you would want to put the powder in your hand and then pat it on the baby, not shake it over the baby. Okay, here's a question. We're not on iTouch, so we'll just answer it together. Your neighbor asked for help with her infant's diaper rash. You would recommend. You're not going to recommend talcum powder. Please don't recommend calling the pediatrician for something that is a minor ailment. When you're a healthcare professional, you can give her advice without telling her medications to use. But of those choices, the best one is exposing the skin to sunlight. Nystatin is a medication. You don't recommend a medication that's prescribing without a license. But we also don't know that it's a candida infection. Seborrheic dermatitis. Pretty ugly little rash that these kids get. It's chronic inflammatory reaction of the skin. It's very crusty in appearance. On the scalp, it's called cradle cap. And if you look at this baby, you can see it's almost in a diamond shape, and that's because it tends to occur at the soft spot. Mothers are often aware of the soft spot, at least this one. They're not aware of the posterior fontanelle, but they're aware of this one, and they're afraid to touch it. So they don't wash the hair at this area, and then we get cradle cap there. It's easily cared for just by washing the hair on a regular basis. If they do have dermatitis, like on the ear or other places, want to care for that, Recognize that it's obstructed sebaceous glands. They tend to be crusty and yellowish, and sometimes will have some oily patches to it. It does itch. We're going to wash it with soap and water, and we may use an anti-seborrheic shampoo, something that contains sulfur and salicylic acid may be used. Okay, so here's another question. Cradle cap can be prevented by, and the right answer is 1, washing the hair and scalp daily. We've already done allergies, but we'll review them here again. Allergic disease is a hyperimmunity, hypersensitivity. These people will contain elevated levels of IgE antibodies in their body. And atopy is another word for allergies. And they have large amounts of IgE and they respond to common environmental substances. It's inherited, have an inherited tendency, so it runs in families. An allergen is a substance. An allergen is a substance which can cause the formation of an antibody. Think of the chicken and egg, which came first. An allergen is what causes the formation of an antibody. An antibody is what's formed in response to an allergen. Okay. Most allergens are large molecular weight proteins, and the antibody is what our body produces against the allergen. It's the body's way of protecting the body from foreign invaders. It's a key and lock system. The antibiotic is allergen specific, although it may react to cousins, to those that are closely related. When you're thinking about, if I'm allergic to this, will I be allergic to that? Think about what is closely related. For instance, peanuts. Peanuts are not related to pecans and walnuts. They're related to sweet potatoes. What determines the allergic symptoms you have is where in your body the cells become sensitized. And when a cell becomes sensitized, that means they have an antibody attached to them. This can be the skin, it can be the respiratory tract, it can be the GI tract. Whatever system will become sensitized determines where your symptoms are. When you have a antigen-antibody reaction involving a sensitized cell, it's like a key and lock. The key unlocks the lock, and histamine is released. Histamine is a chemical that causes the allergic symptoms. Histamine increases glandular secretions. It causes smooth muscle contractions, vasodilatation, and increased permeability. In the lungs, person with asthma, they have moist respirations, they're coughing up secretions. The bronchospasm is that smooth muscle contraction. If we looked in the lungs, we would see that they're very red because the vessels around them are dilated and they're leaking, and that's where your fluids are coming from. If it's on the skin, you get hives, the raised welts, and they're often moist. Another response, an allergen is, and we've said it's a substance that causes the production of an antibody. Children do go through a typical pattern of allergy, eczema, asthma, and then hay fever. First allergens tend to be food because the GI tract is immature, and that's why we delay entering foods that are known to be allergenic into the diet. Typical allergens. Foods, common foods, cow's milk, egg, nuts, sesame seed. Allergens can be found in the breast milk. If the mother ingests the food that the child is allergic to, then the child can have a response to it. Inhalant allergies, the principal allergen is the dust mite. This is that angry little guy right here. He is ugly, isn't he? Inhalant allergens can also be pollens, grass, mold. Diagnosis, we can do the patch test. We can do the skin prick test. Here we see a child and we see the reactions, and you notice the number of reactions they had, some that's more serious than the other. They are done in a particular order so we know what's what. And it looks like this child actually is reacting to the prick itself. They often will have one that's blank to see if the child reacts to it, and that way we recognize that any that match that level, it's a reaction to the prick, not to the allergen that was injected. The RAS test is measuring the antibodies against a particular allergen in the blood, so it's a very safe test. Which diagnostic test carries the greatest risk of anaphylaxis? Obviously, the deeper you go, the greater the risk, and so our right answer is number 3. Number 2 carries no risk of anaphylaxis because we're not injected it into the body. Symptoms of allergens can be all kinds of things. Diarrhea can be a symptom, bedwetting, anaphylaxis. Tension fatigue syndrome. Children who have a learning disability often have tension fatigue syndrome, and that is thought to be an allergic reaction. They're often allergic. Atopic dermatitis, very common, is the rashes, red and oozing, crusty. Interesting thing about this, when the child dehydrates, the rash gets better. When we rehydrate them, the rash gets worse again. Typical sites are where they come in contact with other skin pieces. Atopic dermatitis is pretty much the same thing, except it's on older children. Treatment, they do usually outgrow it. We want to hydrate the skin, not the body, the skin. So be careful about your soaps. Use no soap or very mild soap. And emollient is just something that's going to moisturize it and keep the moisture in there. Reduce pruritus, they may need to be on Benadryl, or maybe use something like Benadryl lotion to prevent, or calamine lotion. Scratching can lead to the introduction of bacteria and a secondary infection. Hay fever is what you may have as an adult. Best thing is to avoid allergens. Allergy-proof the home. Food allergies. If you know what your food allergies are, you can avoid them. Treatment for allergies, antihistamines. An antihistamine competes with histamine at the receptor site. So in order for an antihistamine to be effective, you have to give it before the cell has responded to histamine. So the best thing is, if you're going to go to visit a house with cats and you're allergic to cats, take the Benadryl before you go, not after your eyes turn red and start weeping and you're sneezing. Corticosteroids suppress the immune system. And anti-IgE, again, reduces the amount of antibodies you're producing. Immunotherapy is used to help a child become less allergic. We are trying to trick the body into not recognizing the allergies. We give very small dose of the allergen, and every time they get another dose, they get a slightly larger, as long as they don't react. If they react, we bounce it back down. Recognize that they can have a systemic reaction. Most time it will be a local redness, might have a fever, but if they have a systemic reaction, anaphylaxis can be very serious. I don't recommend you do allergy shots for your child at home. The risk is too great. Had a friend who was a nurse. She would take her child to the emergency room parking lot, give the child the allergy shot, and then they'd walk into the gift shop so that if she had a reaction, they were at the hospital. Remember, the faster the time that you react, the more severe the reaction is going to be. Anaphylaxis, systemic, can be fatal. Remember that the first symptom is that one of feelings of impending doom. Then you have the tachycardia and hypertension, circulatory collapse, respiratory of the bronchospasm, laryngeal edema, and lots of other things. But it's the first symptom of anaphylaxis. And again, it's that feeling of impending doom, number 1. Treatment. Prevention. If they are known to be allergic, be prepared. Medical alert bracelets, EpiPens. Remember, when we're giving them drugs that may cause an allergy, we have them stay around. If they're in the doctor's office, they stay for 15 minutes. Epinephrine sub-Q, we give to 1 to 1,000. IV, we give 1 to 10,000, but a much smaller dose. The 1 to 10,000 is less concentrated. Recognize that. Bites and stings. We have to worry about mosquitoes, fleas, bees, wasps, and fire ants. Local reaction, you're going to apply ice, give antihistamines, or even use your Benadryl ointment may help. Baking soda applied can reduce the itching. If they're having a systemic reaction, they need epinephrine and glucocorticoids, and we may put them on allergy shots. Brown recluse spider. The spider itself is fiddle-shaped, markings on the head. The wound is very ugly. It looks like it progresses to a purple bullseye with white necrosis. Apply ice, clean the wound. They'll need antibiotics, and they usually will need skin grafting. I'm sorry, I don't know where the pictures are that goes with this one. There should be pictures. Black widow spider, you've heard about him. Systemic reactions, muscle cramps, hypertension, arrhythmia. Treatments, ice, and we give them the antivenom. Vector-transmitted diseases. Vector means that another organism injects the bad guy into your system. The mosquito with the West Nile virus is a vector transmitted. The tick can give you Rocky Mountain spotted fever or Lyme disease. The actual cause of Rocky Mountain spotted fever is a rickettsial infection. Incubation periods 2 to 14 days after the tick bite. Symptoms, the rash is a big thing. A petechiae-like rash. And it's treated with an antibiotic. Lyme disease, you hear a lot about that down here. It's caused by a spirochete. They have an expanding red rash. It can lead to other things, arthralgia, encephalopathy, meningitis, and cognitive changes. It is treated with antibiotics. What type of isolation is appropriate for Lyme disease? And of course, it's not contagious, so none of the above. How do you remove a tick? You grab him by the head with tweezers, grab him by the body with your hands, apply petroleum jelly, or burn him with a match. The important thing is getting the head out. So really, that's the way to do it. People talk about petroleum jelly, and it's supposed to make them back out. I've never had them to back out on me. And then they're slippery, and it's hard to get it out. And that completes Integumentary.